My name is Seth Teicher. I'm with the Atlas Obscura. That's a compendium of the world's wonders, curiosities, and esoterica. And the Atlas Obscura is a collaborative project with a global community of far-flung explorers from Japan to Finland to DC to San Francisco who contribute content, contribute their ideas and their perspectives on places they visited and places they've read about that are off the beaten path or obscure, maybe a little bit underappreciated for what they are. And what we do is we curate the content and display it on the Atlas, and then everyone else can work to mold the content, add photos, add videos, what have you. The idea of Obscura Day was to do that, connect people to these places and with each other on one day all over the world. And what we've done is we've brought nearly 4,000 people together in 20 countries at 80 events that are all happening today on March 20th, Obscura Day 2010, the inaugural event. Today we're at the National Museum of Health and Medicine in DC. It's the nation's largest and really only medical museum that documents both medical history and medical military history.
The museum today is the successor organization from a museum called the Army Medical Museum, which was founded during the Civil War. We're 147 years old this year. We are a museum of 25 million objects, encompassing collections as broad as things like you see here, prosthetic limbs, microscopes, as well as anatomical specimens. We have the world's largest brain collection here at the museum, the world's foremost embryological collection for the study of normal human development, as well as a tremendous photo document archive as well. We have objects and specimens from battlefield surgeries and amputations. We also have the bullet that killed Abraham Lincoln, as well as some fragments of the president's skull collected at autopsy. And while we don't think we, as a museum of 25 million objects, find ourselves very obscure, our location is a little interesting to find. So we're glad to participate, and it's been interesting to talk to folks who have visited the museum for the first time, and hope will come back again soon, and see things that they probably never imagined were right here and available to them right in Washington, D.C.
It's actually kind of cool.
Yeah, they showed a lot more than I thought they would for an Army museum. I didn't expect the fetuses in the back.
There was a baby section, and I thought that was kind of cool to see what I looked like when I was a baby.
There's been so many great things, all of the artificial legs through history, the huge collection of microscopes, some of which going back hundreds of years are just like really beautiful objects of art in themselves.
I work with the military for a living, and so seeing the field medicine was really touching. The entire bay moved over from the Iraq War, an entire medical bay, and the concrete.
Including the concrete floor. That was pretty amazing.
It's the emergency room from the Air Force Hospital in Balad, Iraq, and the tent hospital is on display here, as well as the floor where the most American lives were saved or lost since Vietnam.
It's been very moving too, because we just came out of the section of reconstructive surgery for heavily wounded soldiers, including facial and skull reconstruction.
If you're interested in the history of medicine, the history of military medicine, or in the experience of the military physician and doctor trying to treat the injured soldier as far back as the Civil War to today, this is the kind of place where you're going to be inspired by those stories. Plus you're going to see things that you may never have thought you'd ever get the chance to see.